What if the most dangerous part of your day isn't the commute, the stressful meeting, or the workout? What if it's the moment you do the thing you consider safest, fall asleep, because there's a real phenomenon that still shocks people. Many strokes are discovered right after waking. Researchers call them wake-up strokes, and population studies estimate they can make up a sizable slice of ischemic strokes. And separate research has also found that a meaningful percentage of all strokes can occur during sleep, which creates a brutal problem. The exact onset time is unknown, and that can delay time-sensitive treatment. Now, very important, this does not mean sleep causes strokes in healthy people. Strokes are complex. They're usually the endpoint of long-term risk factors like high blood pressure, diabetes, atrial fibrillation, smoking, vascular disease, and sometimes sleep disorders like obstructive sleep apnea. But it does mean something practical. Nighttime is a physiological stress test, and how you sleep, your position, your airway, your hydration, your blood pressure patterns can tip the balance for someone who is already vulnerable. So in this video, I'm going to do something different. I'm not going to throw fear at you. I'm going to give you a calm checklist for the overnight window. What matters, what's uncertain, and what you can change tonight in a way that's safe, sensible, and realistic. And at the end, I'll give you a simple choose your body setup, because the best sleep position isn't an internet rule. It's the position that protects your brain and lets you sleep deeply enough for your body to recover. Let's start with the obvious question. If the body is resting, why would stroke risk show up at night or when you wake up? A few reasons. 1. The clock inside your blood vessels. Your cardiovascular system is not constant across 24 hours. Blood pressure and heart rate follow daily patterns. In many people, blood pressure drops at night, dipping, then rises toward morning, sometimes sharply. That morning blood pressure surge has been studied as a cardiovascular risk signal. For someone with stiff arteries, fragile small vessels, or uncontrolled hypertension, that surge can matter. 2. Sleep-disordered breathing, the hidden accelerant. Obstructive sleep apnea, OSA, is not just snoring. It can repeatedly drop oxygen levels and fragment sleep. Large analyses support the idea that OSA is an independent risk factor for stroke incidence. And here's where sleep position becomes relevant. In many people, apnea is worse when sleeping supine, on the back, compared to lateral positions. Positional OSA is common enough that positional therapy exists specifically to reduce supine sleep time. So if you're asking, why would position matter? For a chunk of people, it's because position can change airway mechanics. 3. Overnight recovery systems need deep sleep. Your brain does housekeeping while you sleep. There's a body of research around the glymphatic system, fluid pathways that help clear metabolic waste during sleep. Reviews describe glymphatic activity as strongly boosted during sleep compared with wakefulness. There's also research suggesting that body posture can influence glymphatic transport efficiency in animal models, with lateral positions showing advantages in some experiments. And to add a relevant GLASP highlight, a GLASP YouTube summary notes that during sleep, glymphatic processes help remove toxins like beta amyloid, and poor sleep can disrupt that cleaning function. Again, this doesn't mean sleep on your left side and you'll never have a stroke. It means sleep quality and physiology matter, and position can be part of sleep quality for some people. So our approach is going to be reduce overnight strain, improve oxygen stability, and support healthy circulation patterns. I'm going to walk through 5 habits that get talked about a lot in these discussions. But I'll be careful to separate what's reasonably supported, what's plausible but not definitive, and what depends heavily on your personal conditions. Habit number 1, sleeping totally flat, with the head level or lower than the heart. This is one of those ideas that sounds harmless. Flat is good for the spine. Sometimes it is, but flat can also change fluid distribution in the body. We have evidence in other pressure systems, like intraocular pressure, that head elevation can reduce pressure during sleep. For example, research on head-up sleeping positions has found changes in eye pressure with about 30 degrees head elevation in certain contexts. Now, eye pressure is not the same as stroke risk, but it supports a broader point. Posture can affect pressure and fluid dynamics. When gentle elevation makes sense, if you have reflux at night, if you snore or have mild sleep apnea and your clinician has suggested elevation, if you wake with pressure headaches or feel worse lying flat. What I recommend, simple plus safe. Think slight incline, not sitting up. Aim roughly in the 15 to 30 degree range using a wedge pillow or adjustable bed, or by elevating the upper torso evenly. Important caveat. If elevation forces your chin toward your chest, you're trading one problem for another. Neck strain, potential airway narrowing, and poor comfort. The goal is neutral neck alignment, not a bent neck. Habit number 2, back sleeping when you have positional sleep apnea or strong snoring. Let's keep this very practical. If you snore heavily, wake up with dry mouth, wake up gasping, or feel exhausted despite enough hours, you should seriously consider being screened for sleep apnea, because OSA is associated with cardiovascular risk, including stroke, and in many people, it's worse on the back. If your apnea is worse on your back, the best position for you may simply be not supine. And this is where a body pillow becomes a simple non-drug tool. Put a long pillow along your back. Hug another pillow in front. Keep your hips and shoulders stacked. This isn't about being perfect. It's about reducing the percentage of the night spent in the position that worsens your breathing. Habit number 3, stacking pillows high under your head. Neck flexion all night. A lot of people do this for comfort, reflux, or reading in bed. The problem is mechanical. Too many pillows can push the head forward and keep the cervical spine flexed for hours. The result is predictable. Neck stiffness, tension headaches, and morning fog that people blame on aging. Here's my rule. If you wake up and your neck feels jammed, your pillow setup is wrong. If you wake up and the base of your skull feels tight, your pillow setup is wrong. Better options: one supportive pillow that fills the space between ear and shoulder. Or if you truly need an incline, elevate the whole upper torso rather than cranking the neck. And yes, this also matters for breathing. A kinked neck can reduce airway openness in some people. Habit number 4, the tight fetal curl, especially with the chin tucked. Let's be honest, the fetal position is emotionally comforting. But when it becomes extreme, knees tight to chest, chin tucked, shoulders rounded, you compress the chest and you can reduce how fully the lungs expand. If you already have decreased lung reserve, chronic congestion, or OSA, that tight curl can contribute to shallow breathing. Safer fetal modification: keep the comfort of side sleeping, but relax the curl. Knees slightly bent, not jammed. Chin not tucked hard. Spine closer to neutral. Add a pillow between the knees to reduce hip torque. Add a pillow in front to keep the shoulders open. This is sleep engineering, not rigid rules. Habit number 5, going to bed right after a heavy meal or mixing that with alcohol. This is where physiology gets messy. Late, heavy meals can worsen reflux, fragment sleep, and push your body into a digestion-heavy state, right when you want stable recovery. Alcohol can relax the airway, worsen sleep apnea, and disrupt sleep architecture, even if it makes you sleepy. If sleep is fragmented, blood pressure patterns and sympathetic activity can become less stable. So, I like a simple timing guideline. Finish a heavy meal at least 2 to 3 hours before bed. If you drink alcohol, avoid it close to bedtime, especially if you snore or have apnea risk. And the most underrated habit, a 10 to 20-minute easy walk after dinner. Not cardio, just movement to support digestion and glucose stability. Now let's talk solutions. But we're going to do it intelligently. Because the internet loves one size fits all. Your body does not. Option A, side sleeping, often left side, great for many people. Side sleeping is widely recommended in different contexts. It often reduces snoring and can improve positional sleep apnea compared to supine sleep. It may support better glymphatic transport in research models, which ties into the idea of brain waste clearance during sleep. Why left side gets mentioned so much? Anatomy. The heart sits left of center. Some people subjectively feel better on the left. Reflux. Left side sleeping is commonly suggested to reduce nighttime reflux symptoms. Gravity and stomach orientation can help. But here's the nuance. For some people with certain heart conditions, one side can feel worse than the other. Comfort matters because comfort affects sleep depth. So my rule is, if side sleeping improves your breathing and you wake up better, it's a win. If left side is uncomfortable, try right side. The goal is stable breathing and deep sleep, not ideology. How to lock in side sleep without fighting your body. Pillow between knees aligns hips and reduces low back strain. Hug a body pillow. Keeps shoulders from collapsing forward. Small pillow behind the back. Reduces rolling onto your back. That setup is ridiculously effective for people who always end up on their back. Option B. Back sleeping with gentle elevation. Useful for circulation and pressure balance in some people. Back sleeping isn't automatically bad. It depends on your airway. If you do not have sleep apnea, or if elevation improves your breathing, then a slight incline can be very comfortable and can reduce reflux. In other contexts, head elevation around 30 degrees is widely used in clinical environments to manage pressure dynamics. Again, this is not a stroke guarantee. It's a mechanical strategy that can reduce certain kinds of strain. How to do it correctly? Elevate the upper torso evenly. Wedge pillow or adjustable base. Keep neck neutral. Add a small pillow under the knees to reduce low back arching. Who should be cautious with this option? People with moderate to severe sleep apnea. Back sleeping can worsen airway collapse. Anyone who wakes up choking, gasping on their back. If that's you, side sleeping is usually the better starting point while you pursue proper screening and treatment. If left side is uncomfortable, try right side. The goal is stable breathing and deep sleep, not ideology. How to lock in side sleep without fighting your body. Pillow between knees aligns hips and reduces low back strain. Hug a body pillow keeps shoulders from collapsing forward. Small pillow behind the back reduces rolling onto your back. That setup is ridiculously effective for people who always end up on their back. Let me give you a mental model. Even if you find the best position, if your sleep is shallow, fragmented, and stressed, your cardiovascular system doesn't get the recovery it needs. So here are high-leverage bedroom moves. 1. Temperature. Cooler is usually better. A cool room supports the natural drop in core body temperature that helps you enter deeper sleep stages. You don't need perfection. You need cooler than the rest of the house. 2. Light. Protect melatonin like it's medicine. Late-night bright light, especially screens, can delay sleep onset and reduce deep sleep. Try a rule: dim lights 60 to 90 minutes before bed. If you use screens, reduce brightness. 3. Sound. Stop micro wake-ups. Even if you don't fully wake up, your nervous system reacts to noise spikes. Earplugs or white noise can be a cheap upgrade if you live in a loud area. 4. Pillow and neck support. Comfort is vascular. This isn't vanity. If you're cranking your neck into a weird angle for 7 hours, you'll wake up tense, inflamed, and you'll move poorly all day. Your pillow should keep your head aligned with your spine, like a straight runway, not a bent straw. I love data when it helps. I hate data when it makes you anxious. So here's a balanced approach. Option 1, overnight oxygen tracking, SpO2. If you suspect apnea, an overnight oximeter can show repeated dips that are worth discussing with a clinician. It's not a diagnosis, but it can be a signal. Option 2, HRV, heart rate variability. Low HRV can reflect stress load and poor recovery. It's not good or bad in isolation. Look for trends. Option 3, a 3-line morning log. Write sleep position you started in, how you feel on waking, 0 to 10. Any symptoms, headache, dizziness, numbness, unusual fog. Patterns show up fast. And if you ever experience sudden neurological symptoms, face droop, arm weakness, speech trouble, vision loss, don't journal. If you try to overhaul everything, you'll do nothing. So here's the plan I'd give a friend. Step 1, pick your base position. If you snore heavily or suspect apnea, choose side sleeping first. If side sleeping hurts your shoulder, hip, and you don't have apnea signs, try back sleeping with gentle elevation. Step 2, fix your pillow mechanics. 1 good pillow, neutral neck. If you need incline, elevate the torso evenly. Step 3, set a clean bedtime runway. Dinner earlier if you can. No heavy alcohol near bedtime. Dim lights. That's it, because the magic is not intensity, it's repetition. I want to zoom out for a moment. The original content frames sleep position like a trigger. And while position can matter, especially for breathing and pressure, most strokes come from layers. Long-term hypertension and arterial stiffness, atrial fibrillation, sometimes silent, diabetes and metabolic strain, inflammation and vascular damage, sleep apnea, often undiagnosed, smoking history, genetics, age, and prior events. Sleep is the stage where those layers can show up. So the goal isn't to panic about whether your left shoulder hurts, because you must sleep left. The goal is to reduce overnight instability and improve recovery. And the fastest way to do that is stabilize breathing, reduce fragmentation, keep blood pressure patterns healthier, protect deep sleep. Which brings us to a question I want you to answer honestly. Do you wake up restored, or do you wake up already tired? Because that answer tells you whether your sleep is actually rest or just unconscious stress. Tonight, don't try to become a different person. Just become slightly more intentional with one thing: your position, your pillow, or your bedtime timing. And over the next week, watch what changes. Morning headaches, fog, energy, even how steady you feel when you stand up. In the next video, we'll go one step earlier than sleep posture, into the 2 daytime patterns that quietly set you up for overnight blood pressure spikes and morning risk, and how to fix them without medication whiplash. Because protecting your brain isn't a single hack. It's a system you build, one calm night at a time. If you want, tell me which is true for you. You sleep mostly on your back, mostly side. You start one way and always wake up another. And whether you snore or wake up with headaches, I'll tailor a best position setup that fits your reality.